year when there are a lot of challenges happening, war around in countries, and then you know about the increasing and escalating energy and fuel prices because of the existing or the presence of war among countries, which means that if we were increasing from 2000 to 2001, and then eventually right now from 2001 until 25 or 26, 2026, then definitely there is the burden of carrying on family and the integration of hope, promoting interventions and shifting from institutional to community based support frameworks. All right. So I hope that's very clear, and you can actually revisit the article if you're interested further about this reviews, this systematic review in supporting the claims that family centeredness and collaborative for mental health among or families among the community is imperative. All right. So, what could be some core theoretical frameworks in this year and onwards? I think you're familiar with family systems theory. So, your family systems theory remains the foundational theory, treating the family as an emotional unit where a change in one member's mental health impacts all others. So, very important is really the systems theory in a family that can be applied in our care. And second framework would be PACES framework, a newly customized family-centered framework developed by researchers in the year 2025 to 2026 that will guide mental health nurses or us through the acronym PACES, which stands number one, P for partnership and collaboration. All right. Second, assess needs. All right. Third, communication. Fourth, education. And fifth, support family needs. All right. Can you repeat it with me? All right. PACES means as PACES framework in 2026 means what? P stands for partnership and collaboration. Okay, can you say the words? Partnership and
Partnership and
collaboration.
collaboration.
Second, assess needs. Okay, I didn't hear you. Assess needs. Three, communication. Can you repeat it with me? Communication.
Communication.
And then E, education.
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 Okay, very good. And the last, all together, we say support
Support family needs.
All right. So that's actually the PACES framework. And then lastly is your family integrity promotion. So this is an emerging intervention aiming to strengthen family relations and resilience in the context of illness. Oh, I so believe that for nurses as we are, despite the toxic environment in the ward or in the facility where we are, we still can emerge with poise and composure and even stretches our patience, correct? Because of this, that families, we are looking forward to go home after our duty, or if we are out of the country for some academic engagement, then we look forward that I will do my best to finish all these things because my family is waiting for me and I have to go back to them. Can you relate that? So that's how family integrity promotion can be applied in the theoretical framework of our care in mental health. Now, there are key themes and trends. So, I have reviewed some articles about Indonesia, and I think this is is actually more common. And I just heard of this long time ago when I was listening to Dr. Shanti's lecture. When I joined the uh, session on INSS and the engagement that I had with UMY. So I think Pasong, I heard about that, and that's the reason why, as always, I would look forward to go back again to Gulong Kidul because of all these things that we have to ground ourselves. What is the reality of families in the communities that we serve? Okay, just like UMY, I congratulate you for your community-based psychiatric nursing program or community mental health program in various communities. And I have been to the community where you have been doing all these things in reality. So I appreciated it much and I learned so much. And that's the reason why I should say I left my heart in Jogja. The same thing with Dr. Shanti. I think she also has a claim that she also have, is it left your heart in MSU IIT or Philippines? I forgot your phrase, but in any aspect, when we are connected with people, especially with our heart, intention, and genuineness, then we can actually propel our intention to help. So that's actually passion, dedication, and commitment. So we look forward that with the trends of today in the literature that strongly emphasizes shifting from ignoring family members to engaging them as essential partner in care, which improves patient outcomes. Okay, so meaning to say, gone are the days, although there are a lot still are in institutions, but we engage family members to take part because they are very important and significant and essential in the care that we have to be working with the family. The second item is on hope promotion. So a key trend in 2026 nursing is actively incorporating. So we have to blend hope into mental health care through therapeutic relationships, active listening, and empowerment. Okay, rather than just treating symptoms. So if we do this, that we just have to be concerned about giving medications, the pharmacologic interventions, then we miss empowering patients. We miss empowering families. We miss the opportunity for communication and interaction taking place with families, with patients, and with um, caregivers or practitioners, healthcare practitioners. So, with that, we have to build relationships that is therapeutic and professional. Okay, I have to highlight that because, true enough, in some of the films I have reviewed and some articles that I have reviewed, and in my personal knowledge, when I go to facilities like jail, for example, there are situations, and even psychiatric affiliations, there are situations wherein nurses and patients are developed in terms of emotionality and relationship to the point of deciding to marry and live together. I wonder if you have the same experience in Indonesia, but here in the Philippines, I heard about a patient and a student nurse and agreed later on after exposure and meet after the exposure, and then the patient has recovered and they decided to make their own family. So I should say there's hope in that. It was brought about by relationships. However, as much as possible, we have to establish the therapeutic relationship and professional for that matter. Okay. Then the third one is relational practice. So, what is this? This is continued focus on therapeutic conversations as a fundamental aspect of family nursing. So we make use of our therapeutic communications other than the techniques and, of course, ourselves. We have to be therapeutic in all our dealings with our clients. And then the last is on addressing caregiver burden. This is a theoretical model for 2026 that prioritizes assessing the psychological, physical, and financial burdens on families of patients with mental illness. Okay, so it really takes patience to really care for mentally ill clients. However, as much as we would like to contain all of it ourselves, but there are limits physiologically, psychologically, physically, and worst, financially. So, in so doing, we as caregivers must address this as well. And even us, there could be some point of burning out. All right. So, that's the reason why we check ourselves once in a while. How are we? Or are you okay? All right. In certain situations that you are facing some challenges in life, like family, work, and what have you. All right. So, this is an article about hope that is fundamental in mental health, and I associated this to the mental health futures that hopefully in the digital world we can actually look into digital wellness, and then of course there could be some climate anxiety adaptation and neuro inclusivity. So these are just a few items available in the net that I have come across, and we are hopeful that this approach with patients' perspective, family carers and mental health nurses are actually still limited. But yet, there is a promise or there is a hope. And that despite the recognition of the role of mental health nurses in maintaining and managing hope, additional evidence is needed on how to promote hope in specialized practice. These are results on open new perspectives for research, training, and for professional mental health area. All right. So maybe we cannot just settle for what is now, but we can look forward with reference to the integration of the available technology and advancement brought about by scientific evidences and outcomes based, that is nursing science in general. There are three theoretical tools that we may be helpful for nurses to understand and our tool to make use of in the care of our clients to hopefully improve our community mental health state. We'll start with family genograms or echo maps. This is helpful to use for family relations and community resources. It's very important for us to trace as to the existence in third generation. I should say that you have to look into some historical background of some manifestations of mental illness and or emotional and mental distresses as experienced in the past from third level generations. Okay, so I will show it later. And then second would be community-based focus. So in community-based focus, it is aligned with the WHO Mental Health Action Plan from 2013 to 2030, which promotes replacing long-term hospitalization with community services, focusing on family-centered intervention in the home environment. Okay, so however, there could be some challenges in community-based focus because there could be some factors that may trigger within the home or outside of the home within the community. So that's a challenge that we have to look into. And then the third would be the perspective is moving towards a holistic model where families are not just recipients of information, but active participants in the so-called, I like this term, co-construction of recovery. Can you say the word? Co-construction of recovery. Can you say it? I didn't hear you. Co-construction of recovery. So, which means with all these things, the totality of our care is very important in caring for family and in caring for the community. So this is what I said. This is available online. You've got to understand the use of genogram uh, in the use of in coming up with your psychodynamics, maybe in one of your case findings later. So you have to consider the grandfather, the grandmother, and then the father, and then you, for example, and then who are your siblings and what have you. Or if you're talking about it with our patients, then definitely this you is a patient. And then you look into the past history on how the grandfather, the grandmother was doing in terms of mental health, and then some other heredofamilial diseases. Are you with me in the use of genogram? These are one of the very important tools that we can make use of. On the other hand, that is to the father's side, and on the other side is the mother's side. Okay, so these are forms of tracing relationships. And very important is to establish reliability. And how are you going to establish reliability in terms of the information given to you during your assessment? All right. So there are a lot of ways to do assessments in psychiatry, right? There are a lot of tools also, like the mini mental status exam. I wonder if you're familiar with it or have you used it. Then, of course, the mental status exam. So definitely, there's so much to do in terms of the tools that is necessary for us to fully come up with a very good assessment. Okay, this will serve as our guide to a more community competent mental health program. So, what are these? Maybe you can ask the question why. So, why primary care facilities are not accessible? Why our involvement of family is not evident? Or how's, why enhance adherence? And why integration with social and economic activity? We can ask the question on that. Second, where? Where could be homes, school, community centers, digital or other technological platforms. That's where, all right? And it's a community. And then what? You raise mental health awareness, psychoeducation, skills training, and psychosocial rehabilitation, case management, okay, and psychological treatments. So this is the what. And then who? Answer the question who. So who could be community health workers or health providers, and then nurses, other health workers like the psychiatrists, clinical psychologists. We actually work with them. And then, very important also that we have to highlight is the role of the social worker. And then teachers, religious leaders, and other professionals. So I remember as part of our case study with our students long time ago, when I was actually following up students in the clinical practice for psychiatry, the role of a teacher during the time background or educational background has to be established is to conduct the interview of how the teacher could fondly recall as much as possible the performance in education when the patient has been with her during the time, like elementary or any stages of educational background that you have to establish. The role of teachers is very important. Or those with the leadership in religion who were able to observe certain behaviors from that time to the most current time. Okay. And some others could be like on the onset of the distress, on the onset of some manifestations of change in behavior, then people around that person can actually attest and give more of the information as you look for some grounds in terms of trying to understand past history and past experiences of your client. And then lay counselors, trained peer workers, and then those are a few that we can actually ask about uh, community component for mental health programs. Then how? We can ask the question how. So consultation with service users. We can also consider community-based case finding. These are possible services, training and supervision for non-specialists, integration into other service platforms, and monitoring implementation barriers. Okay, and lastly, what could be some harms and risks that we can actually look into? One, economic cost. Two, low fidelity with non-specialists. Three, stigmatization of providers. And lastly, burden for providers with other obligations. Okay, so are you still with me? Okay, so send me a thumbs up, and that will determine that you're still with me at this very moment. I'm almost done. And then we ask the question, how communities build mental well-being? So we just look into all these circles around, and they are interconnected with each other. Therefore, we can consider community alignment, community ownership, engaged community, shared purpose, collaborative action, transparent communication, continuous learning, and resource management. So these are a few of the items interconnected in building communities for mental well-being. And then, remember, I have asked you to repeat co-creating. That's why I love the term, because it's actually more of doing it, not just only yourself, not just only the patient, but we do together as co-creating community well-being initiatives. And what is the evidence and how do they work on it? So here we ask the question, how communities build mental well-being. So under this column are principles. I think you're familiar with community alignment, community ownership, engaged community, shared purpose, collaborative actions, transparent communication, continuous learning, and resource management. So in that circle that I have presented previous slides, and then right now, we have to refresh and revisit these principles. And then after that, in the process, there are three columns. And this first column is initiation and planning. So this actually runs down what to be done as planned, or how you're going to be initiating it or starting the program or the activities. And then the implementation, that is actually on the second column in this process. And the last column would be continuation and sustainability. So for example, for community alignment, the initiation and planning is to discover what people want and discover what the data say. So we have to consider what people would say in terms of the needs, in terms of some strengths, and in terms of history, and in terms of maybe adaptation to context. Then for implementation, support aligned partner activities and avoid duplication. And then to the continuation and sustainability, we review if needs or assets have changed. Okay? So we review if needs and assets have changed. So therefore, there is an improvement. And eventually, we can continue on and sustain, or perhaps strengthen first and then sustain certain initiatives along the process. That is continuity, community alignment principle. Okay, so many other things here, many other principles. You can go through it in terms of initiating and planning. These are self-explanatory, and then implementation
Because then
and build capacity, and then many other things to increase the opportunity for community to contribute in many ways. And then down below, resource management. So this is your guide to co-create community well-being initiatives. Okay, so I hope you appreciated much in terms of the very self-explanatory and simple guide in a manner that we work together as one. All right. So in the Philippines, now I'm now shifting it to the context of the Philippines. So if you look into the map of the Philippines, I actually intended to make use of this because I will highlight these areas. And in the Philippines, we have the so-called GIDA. GIDA means geographically isolated and disadvantaged areas. So these are the number of barangays or villages per region in the Philippines as of April 2019. So must be by this time it has increased already. But this is the available data that I have in terms of the image. Therefore, we just have to live into about the grand total of 10,875 villages all over the Philippines that are considered to be geographically isolated and disadvantaged areas. So why am I highlighting this? Because this refers now to socioeconomic status, and then of course the general health condition, and to include mental health of our citizens in the Philippines. So there's really a bigger challenge that people living in these geographically isolated and disadvantaged areas cannot access to healthcare. So by means of accessing, we can look into geographical location or distance from the homes to the health centers. Or I think that if I'm right, it's a post-Christmas. And then or higher level from primary level to secondary or district hospitals, then to tertiary or medical centers. So that's how the gap is established in the Philippines. And good enough for mental health, there is now a support on Mental Health Act in 2018 for the Philippines. So in general, this is actually the summary that we base it on statistics in the Philippines, and then we identify conditions, and then eventually develop certain programs. And then it includes a description of the program, the vision, the mission, objectives, program components, and then partner institutions. And then, of course, the expected program accomplishments or status at the end of each year. So there is now an emphasis on mental health program by the Department of Health with the outcome in mind or envisioning healthy Philippines. It is through the efforts and initiative of the former President Rodrigo Roa Duterte, who recently signed into law the Republic Act number 11036, or an act establishing a national mental health policy for the purpose of enhancing the delivery. What are these services? So hopefully it is expected that the Department of Health in the Philippines will deliver integrated mental health services. That's a wonderful thought. And then reaching out those GIDAs, all right? And then promoting, protecting the rights of persons utilizing psychiatry. And then neurologic, psychosocial health services, appropriating funds thereof and for other purposes. And this was signed June 20 of 2018. So the new law is also known as the Philippine Mental Health Law that strengthens the government's commitment to secure the rights and welfare of persons with mental health needs. So it is into law. Therefore, it's very important for nurses to understand this because the law actually stipulates a lot of services that every citizen has the right and welfare to enjoy in the Philippines. Now, this is an example of a puskas mas or the health center. This is how it others right now in most recent observations in the municipalities, like if those students who visited Philippines, particularly Lagindingan, we have a lot of municipalities from the airport going to MSU IIT. Therefore, you can actually see this kind of health centers. Some are having second floors. Um, that is already an enhancement of the ground floor or the first level, and then eventually the second level has um, other things and other services. So in the Republic Act 11036 in the Philippines, providing mental health services, it actually will reach barangays or villages. It integrates psychiatric, psychosocial, and neurological services at the regional, provincial, and tertiary hospitals. So this is how it looks like in the Philippines. So there's a health provider, and then consultation is done at the center. Okay, I think that's also the same with Indonesia. Now, this is an example. So for admission assessment, then it goes to management of cases and then management of cases. So where is this happening? It's actually in the village, and then it is happening in barangay health stations. So there is this steps to do that is telling each one. This is in the vernacular, in the local vernacular that says, sulod ka magpungko. All right. So it actually talks about come in and then please sit down. Okay. So that's the first step. And then the second step would be magkuha sang vital signs. So then vital signs are taken like the BP, body temperature, pulse rate, and then respiratory rate, etc. So these are the second step routines. And then eventually third will be patient assessment is done. And then with basing on history taking and examinations, physical examinations, and physical assessment, then the patient care is actually formulated. Okay, so here, after all the interventions, care provided by the provider, usually the nurse, then patient hopefully is discharged and then eventually looks into record management later on. All right. However, if it actually is needing referral, then the provider refers the patient to a higher level, and then eventually a home visit and home care is done also. So two-way referral system is made as a mechanism from the barangay level to the various levels of care in the Philippines. So these are the various levels in the Philippines through the Department of Health. One, we start from barangay, then two, municipality, then provincial, and then national department of health. So in the Philippines, we also have specialty hospitals that is under the government. And if there is a need for certain referral from this level to this level, and then up there, and then to the national level. So city health centers is manned by doctors, nurses, midwives, and barangay health workers. In the barangay health station, it's only the midwife and the barangay health worker. And in the barangay health post, it's only the barangay health worker. I hope that's clear in terms of understanding the organizational structure of the Department of Health in terms of how to implement the mental health law for a certain group of people in the Philippines. So, furthermore, the law highlights the role of different government and public sectors to fully implement this measure. So, the Department of Health, in collaboration with the educational institutions, will incorporate mental health in the school curricula, while schools and workplaces will develop mental health programs and services. So, if you will see here, there is what we call the Department of Education, and then other inter or line agencies that will actually represent the workplaces. Okay, so it has been launched in support of the law. All right. Then second, there are a lot of programs through the Department of Health. So, say for example, hotlines are actually open for those who've been needing help through a hotline, and there's a number. Somebody has to dial it, and then eventually answer the question, "Kumusta ka?" or "How are you?" Let us talk. Okay, so tara, this means tara, usap tayo. Or hello, let's talk. Okay, so something like that. So how are you? And then come, let's talk. That's actually the interpretation or the translation of the local language used in terms of the crisis hotline instituted through the law. So the Republic Act 11036 in response to the increasing cases of depression and suicide among Filipinos. Okay, these are two conditions, depression and then suicide. So according to the Department of Health, 7 Filipinos turn suicide every day. In fact, and in 1 in 5 Filipino adults suffer from a form of mental health concern. The most common of which is, what is the most common? Can you read that on slide? What is it? It is depression. All right. So this claim is supported by the World Health Organization's report, which cited that in year 2012, approximately 2,558 cases of suicide in the Philippines was recorded. And for sure, because it's been a long time, most currently, I also believe it's increasing. And these are some of the programs the Department of Health are offering to all citizens. And it's in the local language, which say, as I already have said, tara usap tayo, hashtag usap tayo. So meaning like, let's go, come, let's talk. Okay, that's an advocacy or a call. And then here is Vida ang mental health. So it's actually like championing, Vida, championing mental health. So it actually emphasizes safe and secure leisure and outdoor activities that will actually keep you moving, right? That's actually to be active each day. And then there's more fun under the sun because remember, if you have exposure to the sun, then it's actually will liven up your spirit or your body and circulation. And then, of course, your vitamin D and what. So it actually like boosts your immune system as well. And then be cautious for heat stroke because at any rate for the climate change effect, then definitely we do not just only think about emotions and psychological aspect, but also the conditions of the heart, the brain, and the whole body system. Okay, so those are just examples to be active and to find a hobby and then to be leisurely having some forms of relaxation and then online dance classes or whatever it is, then you just have to keep yourselves moving. And then some others are the crisis hotline or the availability for free medications, especially for mental health conditions. So there is a cue card, and then for sure, these are the list of mental health access sites in National Capital Region or in Luzon, Visayas, and Mindanao. So it's actually per region, per province, and per city. These are actually accessible. Okay. So then these are also collaborations of a lot of departments. So all the logos here are collaborating agencies like the Department of Health, the Social Welfare and Development, Department of Education, the Commission on Higher Education, and many more agencies, all right, mentioned in here. So that's how it works here in the Philippines. In the effort to raise public consciousness on various mental health issues, available support and services will gradually reduce and eventually end the stigma against mental illness. All right, the call for suicide prevention through the Department of Health. And then this new law means that many people will finally receive much needed help that is in line with the attainment of SDG number 3. Okay, it is good health and well-being of every Filipino. Okay, so don't forget that or remember this. SDG 3 for good health and well being. So then there are also programs like advisory on the national mental health, on maintaining mental health and well-being. So there are guidelines here, pamphlets, and available online through Facebook and in the website of of the Department of Health in the Philippines. So as I have mentioned earlier, there's a call for it's okay to be okay, not to be okay. And there are hotlines also. Okay, this is from the National Center for Mental Health. And then e-consulta, it's online consultation from Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. from the National Center for Mental Health. This is free online psychiatric consultation sessions. And this is how it looks like in the National Capital Region or in Manila for the National Center for Mental Health. So I've been into this place and I have seen all these things there because when I was also a dean, I made sure that the exposure of our students will be in place. And the school that I have been a dean, our affiliation center is usually in Manila. These are national um, hospital, national Department of Health facilities on very specialized areas like psychiatry, and then another national features also in Manila are or national facility are your kidney institute and then heart centers and then the lung center and orthopedic center and a communicable disease center. So these were some of the big hospitals in Manila that our students are being exposed to way back when I was a teen. I think it's also similar to Indonesia in terms of facilities. And then look at here, still the nurse is at the core and at the forefront of mental health care in the area. And then another features of the Philippine mental health program is identifying the awareness pH. So in the map in green, these are areas where you can actually seek for help for mental health conditions. So you're just going to select a point on the map to display more information. You may use mouse scroll wheel to zoom and in and out of double click to zoom in, hold and scroll to pan view a certain facility. So it says, do not be afraid to ask for help. There's always somebody or someone ready to help you near. So this is the Philippine Suicide Hotline. So these are the areas here and then the number. Okay, so and then more information when you click this online and then it gives you details and information necessary for you to seek for help. This is an example in Manila or Luzon. And then here, this is Luzon and then Visayas and then Mindanao down below. So showing here the nearest help is actually identifying to where your region is. So if this is the Philippines in the map, so Mindanao is somewhere here, like Cagayan de Oro and Iligan. So I think, and if you are in Cebu, you can also have the chance of accessing it, and then in Luzon as well. In conclusion, so the key way forward for global mental health includes strengthening community-based care networks, decentralization, which means that we move away from custodial institution-based care toward community mental health services, such as community mental health centers, your peer support, especially in the universities or schools. There are peer supports that are actually being trained to cater to the needs of their peer because there's a tendency that peers, with my experience in disaster, doesn't listen to older persons. They'd rather listen and heed advices at their peer level. Okay, that's why we have to take note of that and supported living. Therefore, another item that we can move forward is to integrate primary care, embedding mental health services into routine primary health care, making them more accessible, affordable, and less stigmatized. With that, I say, terima kasih. Let us talk after this, and maybe you have some queries or inputs. I would appreciate that. In the Philippines, we say, maraming salamat. So this is a Tagalog version of thank you very much or terima kasih. And in Visaya, daghang salamat. Thank you very much. And I give back the platform now to the moderator, Dr. Shanti.
All right. Thank you so much, Dr. Neil Martin. And it's such a wonderful and insightful lecture today. And now we're going to answer and question and answer section. We already have two question in our chat room. First is from Pak Mukhlis, yeah, your student, Dr. Neil Martin. Yeah.
Hello, how are you, Pamaklis?
Fine, Doc.
Hi, very good. So happy to see you.
Yeah, I will read the question.
Yeah, please.
Thank you for the material. Then the roles of family is very important in the recovery of patients with mental disorder. I would like to ask what kind of nursing intervention are provided to family while the patient is in hospital. Could you give some examples? Additionally, for the community nurses, how can we evaluate whether these interventions are effective when applied to the family? Thank you.
All right, wonderful question, Pamaklis. And I will bring you to the institution where we have visited. It's actually what we do practice in House of Hope, remember? Together with the team, we went there. And if you can see, remember, I have taken photo of the two structures in front of the facility. It is actually the receiving area that a cottage looks like a cottage. So that is where families meet their patients while visiting. All right. So in that manner, that is a very good point that part of the family intervention is to provide an avenue for them to meet and eventually establish communication. So when we say establishing communication, it's really very important to say, how are you? I'm here to visit you. Are you okay? Is there something that you would want me to know about your stay in here? How are you? And then so do, I mean, like all throughout the day, like an hour or two, it's actually given for the families to be there. And then usually in Filipino culture, when the family express the time for visit, then they actually inform the nurse in charge in the facility, and that it will be facilitated because especially for those in the cell, the CIU, if you can remember those individual cells, they have provided like a cell and then they can actually visit. But for those also like manageable and they're actually staying in like the male, for example, area or the female area, then they have to be taken out and then brought into the lounge or the meeting area. So then they're allowed actually to bring food in there. They're also allowed to eat together with the family. So that's actually like providing time other than providing the place, allowing howdy moments, and then providing the atmosphere of food sharing, maybe something like the favorite of the patient. Then a visiting family will bring, and because these are fond memories of a family expressing genuine love and care for their patients. So with this, there are also like other family activities. Maybe they can also do like play activities, provided with some game boards. They can actually be provided with some activities together with the family, and as well as in the supervision of the nurse if there is a need. But usually, only for new patients and new family that we actually like cater to this. But for those coming in and out already, then we just have to supervise shortly and then eventually leave them and have their space for them as one big family. Okay, so I hope that will be very clear. Did I answer the question?
Ya, another.
Alright.
Gimana Pak Muklis? Sudah jelas?
Saya kesulitan dengan bahasanya, Bu.
Oh
Banyak
ya,
saya
ya
kesulitan.
Dr. Neil, I will translate first in bahasa.
Sure.
Ya,
Okay.
jadi selama pasien di rumah sakit, apa yang bisa dilakukan dengan keluarga, terutama ketika keluarga menjenguk. Nah, ketika keluarga menjenguk, pasien akan dibawa keluar. Ketika pasien ada di ruang masing-masing, kemudian mereka akan bersama-sama ada family therapy, kemudian ada aktivitas bersama seperti makan bersama gitu ya. Kadang-kadang juga difasilitasi untuk bermain bersama, olahraga bersama ya, misalnya ada badminton dan lain sebagainya. Nah, kemudian juga diberikan edukasi. Nah, ketika menengok gitu ke rumah sakit itu kesempatan untuk diberikan penjelasan. Kalau pasiennya masih baru, tentu saja tidak bisa ketemu langsung ya dengan pasien ya kalau sedang krisis. Mungkin itu Pak yang apa namanya bisa saya
Hampir
jelaskan.
sama berarti ya, Bu.
Yeah, it's I think the intervention is same that we do in Indonesia, Dr. Mel.
Okay.
Okay.
And I think, may I add,
Yeah.
because the last question was, how can we evaluate whether this
Oh
intervention
yeah.
is effective? So, as always, it's very obvious last time when we were visiting the facility that in one directive of the nurse, they actually listen and cooperate immediately. So back to the patient and the family's relationship, I think it would be successful when there are no tantrums manifested by the
Yeah.
patient, especially when at the time to say goodbye, because the patient is assured that the departure of the family after a visit is no longer something that will threaten the patient and put her to or him to risk. Rather, it is strengthening the foundation of trust that eventually the patient's family will come as regularly as possible by schedule and eventually do the same thing as a family given a situation in that facility.
Okay, thank you. Jadi tergantung kondisi pasien keberhasilannya Pak Muklis, intinya seperti itu. Alright, we are going to the next question before we please for the audience who want to directly ask to Dr. Neil. Okay, the second question is I would like to ask about the role of nursing in supporting community-based mental health and how our contribution increase mental health awareness. Do you mean Mbak Rizwi? Do you mean our contribution, the nurse contribution, right? Yeah. Okay.
All right. Yeah, thank you very much for that question. It is so real that you're so up to what is your role. It's very important to really clarify your roles. And more importantly, advocating for your clients is most important in a manner that you have to articulate and communicate so well in a manner understandable at the level of the public, say for example, and all the family. Because at any rate, for us nurses, we studied a lot of jargons and terminologies. And then for our families, they're actually not health related. Usually, good for those who are health related. However, in general aspect, like the public, how you're gonna be advocating is through the mechanism on reaching out for certain advocacy that you do. Say community service, for example, like talks. All right. So, say for example, Miss Julie, the head nurse there, is actually invited online because they're having talks about mental health awareness during mental health day celebration that is a national level celebration, and then regional, provincial, and what have you. So nurses are given the opportunity to reach out a wider range, a wider reach of communities, either online and in person, and even the development of materials like posters and brochures, and even postings in the Facebook and
Facebook, yeah.
online that you and even blogging about how to be conscious and aware of mental health. uh, in so doing, these are potent roles of nurses to reach out a wider reach. Other than your example, we are very critical in our way of life. That when we try to articulate and convey health education, we must live for it and with it and by it. Okay,
Yeah,
so
yeah.
yeah, that's very important because, say, for example, if you will say chocolates and alcohol and smoking are contraindications of your medications, and then you allow smoking, the use of alcohol and the like, which is haram. So therefore, that's not a good example. So we just have to be living clean in a manner that patients and family sees us, and of course look up to us as role models in
Yeah.
healthcare. That's all. Thank
Okay.
you.
Thank you, Mbak Rizvi. I think you have got the answer, right? So next is I give the time to Mrs. Chita. Yeah, your student also. She want to ask directly.
Hello,
Okay, good, good. Hello, Shira. How are you?
Goyang
sir.
du go, go, goyang dumang. Do you remember?
Yeah,
Good morning, Dr.
yes,
Neil.
good morning.
Yeah, thank you for the insightful and comprehensive presentation. I truly appreciate the depth of your explanation, particularly regarding the role of family and community in mental health nursing, which is highly relevant to current clinical and societal challenges. In many contexts, especially within culturally diverse community, family involvement plays a significant role in mental health care. However, this also raises important ethical consideration in professional practice. I would like to ask to you, what ethical challenges do nurses faces when balancing patient autonomy and family involvement in mental health care, and how should be addressed in real practice? Thank you,
All
Doctor.
right.
Thank you so
Thank
much.
you
I
very
think this is the
much.
question is very important, Dr. Neil.
Yeah. Um, this calls for a culturally competent nurse, which means that it is highly important that you know a certain background of the patient's background in terms of beliefs, values, of course, contextualizing it in religion, for example, because these are some practices that may alter the care of the patients. Say, for example, when it comes to care that is actually unified, because they are actually institutionalized, right? So, whatever the food, for example, usually food preparation must be very clear that if we have, I think, if you can remember Frankie, Dr. Shanti, when we visited, there is Frankie lying down in one of the cells. He's actually a Muslim. And so it's unfortunate that he is neglected in terms of his own values, his own beliefs, because of the unified preparation of food.
Mm.
Now I actually look back that it has to be that the nurse will initiate how food preparation is intended for a very specific and isolated case given, particularly on halal, for example, because it's in a way respecting. It's not actually like putting them to no choice because they are in the facility, they are psychiatric patients or having mental disorder, but still they have to be respected and they have also their own rights to practice their own beliefs and values. So I think not just only in psychiatric facility, but in clinical practice setting, upon admission, it's very important to know certain backgrounds like religion, for example, because when you call the dietary for food, um, diet, right, in the list, they have to be considered that they are having certain um, restrictions. In a way, we live up to and respect their own beliefs and religious practices that we can actually facilitate. So this is very sensitive an issue other than maybe, for example, Hindu or like others don't eat the beef, for example, because they have high respect to animal care and some religious considerations. So let's be very careful about all these things. So that's one aspect that importantly the nurse must be clear on certain backgrounds because at our end it's innocence in a way and ignorance at the same time. We've got a poor history taking, poor assessment that will actually jeopardize the patient, although we have to agree that they seem not to have the choice. But we as nurses must be competent culturally and look into the diversity, as I have mentioned earlier,
Yeah.
inclusivity. That is really the principle of our care. Other than Catholics, for example, and even Protestants, and many others like Chinese people have certain restrictions of food other than medically restricted, but it's more of beliefs and cultural practices. Like, say, for example, um, Protestants or like practicing Christians does not eat blood. But in the Philippines, together with the lechon, that is pork, it has to be with the blood menu. I don't know if you're familiar with this, but it is known to be sampaina. Sampaina is a cooked blood with internal organs that may not be, that is actually not allowed or haram for Christians. Something to do with that. So, therefore, the challenge is to be respectful and to be inclusive rather than exclusive in the understanding of the cultural background, practices, and the taboos as well for every individual, regardless of their conditions in our care. I hope that is something helpful and was able to answer the question, Sita.
Yeah.
Thank you very much, Doctor.
Yeah.
Yeah.
I would add maybe the point is we have to can give a advocacy for the patient. Yeah, if the patient is they have to have their right the right choice in their life. Yeah. Okay. And we still have two questions. Is it okay,
Sure.
Dr. Neil?
Sure, go ahead.
Okay. Mohammed, time is yours.
Hello, Muhammad.
Okay,
Uh,
thank you for letting me ask, Prof. Neil, and thank you,
All
Prof.
right.
Shanti. And we are blessed to be here, Dr. Prof. Neil, and we hope in the coming days we have another meeting with you.
Okay.
Okay. So
Sure.
in the beginning, the first slide was about the tips of a good mental health,
Mm,
like be active and eat healthy and get 8 hours of sleep every day and the other. So my question is, how if one or two components of the tips for good mental health are missing, will this negatively affect an individual's mental health? And my second question is, um like in the Muslim country, we
mm,
took the religion as for our mental health. So in the Philippines, I think in the most of Philippines population, their religion is Christian. So are they take the religion as for their mental health or not? That's my question. Thank you.
Thank you, Mohammed. Dr.
Okay.
Neil Mohammed is come from Yemen,
mm.
or student from Yemen. Yeah, so maybe the pronouns and also his face is different from
Yeah.
Indonesian people. Yeah, maybe you
Yeah.
can. Yeah.
All right. I'm sorry, I did not get the last question, Mohammed. Can you repeat? Because the first question, if I'd like to
Ah,
follow through, is with all those given tips, will it matter if one is missing or not?
Yeah.
Correct?
Yeah.
All right. The second question,
Yeah, the second question I'm talking about the religion, because
religion.
in the Arab country we took the religion as a good for our mental health.
Yeah.
So
Mm,
yeah, so I mean, how about like in the Philippines or yeah, because
Christian.
in the Philippines population, like there I think most of them their religion is different. So I ask, are there talk the religion for their mental health or not? That's my question.
Yeah. All right, thank you. And indeed, Mohammed, you have been listening and noting down my presentation, and thank you very much. So that's a very good indication that I should say you are in good state of mental health.
of course.
Okay, so
Thank you.
yes, and thank you very much for that. So definitely, I think I would like to answer first about religion. So as I have made mention, there are haram items or that is actually not to be taken, and even like uh, there is a need for respect in the peculiarities, diversities, and uniqueness of individual, particularly at the context of a nurse. You have to know this because at any rate, when patients don't seem to have a choice, but you are the advocate for your patients, therefore you have to amplify this. You have to talk to the doctor in behalf of the patient that's advocating that, hey doctor, I think it's more important to refer the patient for a dietary consult, especially on certain foods that are necessary for a certain individual, in line with the religious practices, the taboos, and some other religious customs and traditions that has to be
Yeah.
carried out. So in the Philippines, for example, and I so believe the same thing with the Muslims and some other religions all over the world, that there is really a guide that is actually causing every follower of that belief and traditions, particularly on nutrition. So there is something in the Bible and even in the Quran that tells us, do not take this and you can take this. These are actually options, in that as much as you are aware of and you are conscious about it, then you must be able to advocate for the patient. On the other hand, if and when seemingly the patient insists, other than it is in contrary to the policy of the hospital, for example, that foods are not allowed for this kind of environment. So there has to be some form of education that will actually um, explain and discuss with families that should not be taken in or for what reasons at all, with due respect to some other people in the ward, for example, and then for other practices. So we are guided with some um, guidelines through the Bible, particularly in the Philippines, Bible for Christians. So um, they actually follow this, I should say, to keep up the mental health with them. However, for those who are actually insistent, like non-practicing, they claim to be Christians but not practicing, so they actually abuse,
Yeah.
like alcohol, for example. It should not be taken inside the floor, right, or in the ward. And if they insist, then they're actually abusing their rights and should not be neglected or ignored, but rather for proper education and conference with family and or individual. This will actually avoid certain circumstances of violating certain beliefs and practices in the Philippines. So then the second one is from among the list. Actually, there are a lot that you can do more. It's just a matter of not completing all together. If you can complete all, why not? But there's like establishment of balance. Okay, as I have mentioned earlier, anything too much or too less is not good for health. So make sure that you can have a little of everything. And if you fail to another one, then maybe move to the second and third and fourth and perhaps establish the balance. All right. So maybe I can ask you, Mohammed, what is it that you cannot do from among the tips?
Okay, I can do it all.
Is there something?
Okay.
Correct.
Yeah,
Very good.
but there is some
So congratulations.
yeah, there is
Limitation.
just one that maybe I can, like, about the sleep. My problem
Right.
in the sleep, yeah. So so most of the days that I have a lot work, and so maybe I sleep like at 3 night or 4 night because I need to be awake for other night. So it's effect on the mental health like this. Yeah, that's what.
Okay.
Yeah.
Good. Listen, that is only a guide that ideally a person has to sleep in average 8 hours. However, it's still useless if you have seemingly claimed 8 hours, but you don't have a peace of mind that you have slept so well. So, in other words, it is actually dependent upon individual. If you think that 4 hours is enough with good quality and good well-being feeling as you wake up, then that's fine. But because some other points, like if you have already claimed that you have slept 8 hours, but after all, when you wake up, you're still sleepy, you are cranky and all. So that's not good quality sleep. All right. Other than be very careful because my students are actually taking coffee, cola at the same time. And then they mix all and then something like a tonic drink. Oh my. So it's an abuse of the body. So take in moderation possible and please be cautious about some ingredients in the bottle that you have to read in terms of beverages intake. Uh, Especially if you're talking about stimulating yourself to keep yourself awake, then please avoid as much as possible and do naturally because at any rate it will do you harm. Okay, like too much coffee and then mixing up with another kind of coffee and all, so it's actually increasing The concentration for what is the active ingredient of coffee? It is caffeine. So not good. Okay. Do it in moderation as well. So congratulations, you have almost all of them except for sleep, but make sure you sleep in quality time. Okay, meaning you free yourself from any of the thinking on assignments and what have you. That's why there are also tips that before you sleep, you keep away 30 minutes to 1 hour from your phone. That will prepare your body to focus attention to getting a better sleep. All right,
Yeah,
Mohammed?
okay. Thank you, Bro Neil. Thank you for your
All
time.
right. Okay.
Okay, thank
You're
you,
welcome.
Muhammad.
Thank you very much.
Yeah, you are
Thank
welcome.
you. And then it is our last question. Mbak Nur Ainisa, you want to ask to Dr. Neil? Yeah, please. Are you reading motorcycle? Be careful, yeah. Okay. Can you
Ibu suaranya kedengaran, Bu?
kedengaran? Yeah, we can listen.
Ya, aku maaf di sini untuk basic. Hi, from Dr. Nail. It's an honor to me to hear with you in your class today. That I need a question. We all know that today mental health is a serious issue, and most people experience with mental issue is not stay in the hospital. It's just say almost of them just like me maybe we stay in the office living as usually. We care about future. We have anxiety order too much, and maybe we as a community we have maybe we just know the other if they have a mental issue, but how about ourselves?
Right.
And the
Yeah.
question is, uh, how we can know that we ourselves that have a mental issue? Thank you,
Thank
Doctor.
you, Mbak Nur Ainisa. Dr. Neil, do you get the question?
Right. I hope I got it right. That
Yeah. First is
um,
maybe about the workload burnout.
yeah. Okay. So the way I actually understand the situation you are in, Miss Noor, is that you are overwhelmed. Meaning to say that the world seems to be so huge for you to carry. Particularly if you're talking about work, for example, there's so much of work to do, but lesser time. And then that's how you're actually reacting to the situation. With which, for nurses, and the question is, how do you know that you are now towards borderline or towards having a mental illness? All right. So, uh, calm down first. That's why I have introduced the breathing in and breathing out technique, because you need to pause. You need to pause amidst your busy schedule. That's how it is. You stop first and then take a back off and see that the world is just small. It's actually mind conditioning, because this is something doable, as my experience would warrant me. That if it's so huge, then I just have to pause, take a deep breath, back off, and then eventually see the huge thing as kind of small within your hand. And eventually look into some parameters of what you can do, what you cannot do. And if there are some prioritization that you need, look into some priority, which things first that you have to do. All right. And maybe it would be helpful that you need to seek for help. If it's so much of you, then you need to talk it out to a friend at whom you can trust. Because when you try to talk, then it actually will release negative energies. It will unload you. That's what you call catharsis. All right. And then just right now, I can actually feel that you have the opportunity to talk and articulate, and it slowly releases the tension at your end. Okay. So, with that, it would be very helpful also that you have to journal, to make a journal if it works for you. Then, just like me, what are my priorities today when I wake up or before I sleep at night? I have to imagine for the next day what are my priorities. I write it down. What must I do first, second, and then third, or the priority that I have to be handling the next day for some importance of my work. And then chunk it out. The next day, I will also list what are those things, and then eventually finish up the whole week. And importantly, if you feel so overwhelmed, if it works for you, it works for me. I listen to music, and I even sing on my own. That's actually like expressing yourself, or maybe you can write, because this is something that is normal for you to release tension, to find yourself's value, and even like look into the mirror and talk to yourself once in a while, but do not laugh. When you talk to the mirror by yourself and you laugh at something, maybe just a smile and then just boost yourself and then, you know, tell yourself that, hey, it will be a very good day and you can do it. It's a positive thinking mindset. Then, of course, you get the ball rolling for the day. And importantly, to think well is to get enough sleep. To think well is to eat a balanced diet and free yourself from distractions like social media. Just right now in the Philippines, our political scenario is so toxic. That's why
So
I do
yeah,
not, yeah.
it's it's same situation in Indonesia.
Really? So I do not, I actually skip. I actually
Yeah,
skip those,
yeah, 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 yeah. Me too, me too.
right? So do something that is meaningful for you. All right. Something that you love to do. And then after that, maybe for 15 minutes, then you go back to work. That's actually what I do. And even like, listen to some funny, sometimes I have a drama box in my phone. So I just happen to like follow through a certain drama box, and then eventually when I feel like I'm okay, then I just have to do back official business again. I hope that helps you, Nor. Very important is someone you can actually talk to, reach out, to someone you can trust, and then maybe in Facebook, in emails or call, you can actually do it. I hope you will ease out your um, overburden and then burnout situation as a nurse.
All right. Wow. Uh, very expert tips, yeah. And Mbak Nur Anissa, you can practice about this Dr. Neil give tips to you and of course to all of us, yeah, because every day we have never stop. The work and the task is never stop, never stop. We are still also to thinking our family. It is also some of our problem is every day, but it's okay. Everybody has their own challenge to fight the stress, yeah? Okay. Thank you, Dr. Nail.
Yes, you're
Yeah.
I just would like to highlight, Nor, according to Dr. Shanti, you need to practice. You
Yeah.
have to get started.
Started.
Just like the breathe in and breathe out, that's a very good point to start.
Yeah. Sure,
That's a
sure.
very
It's a simple.
very
It is
simple.
simple. Yeah, very simple.
But it will relax you and then eventually give you a peace of mind. And remember this, being peaceful and is not alone. It's just like solitude that you just have to repair yourself and keep yourself away from the stresses in life and then just make up your own self and back again. All right?
Okay.
Yes,
Okay,
thank you.
Dr. Neil, thank you so much. As we come to the end of the today's session, allow me to highlight one important takeaway from this lecture. That's mental health care is not solely the responsibility of health professional, but also where the families as community play a crucial role in supporting individual with the mental condition. And we know in nursing, we also believe the one of theory, if I'm not wrong, yeah, Dr. Neil, is about family as a partner or community as a partner. Yeah, no, so we cannot do alone. So involve them, include them in our intervention. And the last but not least, on behalf of the Master Nursing Program, we would like to express our deepest gratitude to Dr. Dale for sharing his knowledge and also make a insightful with us today. We and also we are also silently thanks to all the participants for your active engagement. Today we have many questions, Dr. Neil. It's mean that they catch your lecture. And hopefully this today's session inspire uh, us all to contribute promoting in mental health, not awareness, not only for the people but also for ourselves. Yeah, and we are becoming of the supportive system for individual, family, and communities. Thank you very much again, Dr. Neil and Maraming Salamat. And
Yay! You know well,
and
yeah.
yeah, I would like give show you our thanks from our head of Master of Nursing for Bu Aziza, Dr. Aziza Khairiati. Today she cannot come our lecture, but she gave a regard for you and thank you very much. This is certificate awarded to Associate Professor Dr. Neil Martin, PhD. Thank you so much. Give a big applause to our lecture. Thank you so
You
much.
so cool. Always with
Okay.
them and
Thank
Dr.
you so much. And we hope we can meet again. Any event. And
Yes.
thank you so much. I will close this session with Alhamdulillah together. Alhamdulillahirrahmanirrahim. Wassalamualaikum warahmatullahi wabarakatuh. Mbak Ica, can we take a picture?
Yeah, sure.
Please open cam for the student. Thank you so much. Okay. Today we have 45 participant, Dr. Neil.
Oh,
But
great.
yeah, but maybe today is Friday, so
Yeah, free.
some student who going to the mosque.
Yeah.
Oke, Mbak Ica bisa di ini kan? Oke, let's start. Open. One and second. Bentar. Ulangi lagi ya. 1, 2. Ya, oke. Terima kasih banyak. Bila taufik wal hidayah. Assalamualaikum warahmatullahi wabarakatuh. Selamat melanjutkan aktivitas. Thank you so much, Dr. Neil.
You're
And
welcome.
I will send the certificate to WhatsApp.
Yes, thank you very much.
Thank you so
Bye-bye.
much. Bye.
Yes, bye-bye. Enjoy the weekend, Dr. Shanti and the
Okay,
students.
enjoy the weekend.
Bye.
Bye.